Hi, it's Dr. John Raymond Baker, DC, and today we're going to talk about a topic that you may not hear much about on the major news media, and there may be a good reason you're not hearing much about it. Now, jump back a few years, there was a bacteria which is well known called Staph aureus. It's found in a lot of hospitals. It's what's called a nosocomial infection, meaning it's acquired often in hospital settings. And at some point, they started noticing that a drug that they were using to treat Staph aureus became ineffective, that being methicillin. So a new organism basically was born, one that was resistant to methicillin, and it was titled MRSA, MRSA. And for decades, MRSA was the scourge of hospitals, and it tended to be confined to hospitals because you had a lot of people that were immunologically compromised, and MRSA could take over their system a lot quicker than a normal, healthy human being out in the real world. And at some point, though, MRSA actually jumped to the outside world, and you start having kids, guys on baseball teams who were coming down with MRSA because of the close quarters and dressing rooms, etc. Now, MRSA had one drug that was used against it. It was like, our last ditch effort is this serious drug that was very expensive called vancomycin. And a few years ago in India, I believe it was, they discovered a form of MRSA that was immune resistant to vancomycin. In fact, that form of MRSA seems to be immune resistant to every kind of antibiotic intervention. Now, allopathic medicine, that is what MDs and DOs practice, is highly based on drugs. Whether you're talking about artificial forms of thyroxine, or you're talking about antibiotics, or you're talking about a whole plethora of things taken by mouth, injected either IM or IV or whatever, the artificial armament of the allopathic system has really been their mainstay. And, you are given medications before a root canal, or especially if you have an abscess tooth, for example, or you're given meds in different situations that are prophylactic, meaning that just in case you get it, they want to give it to you so it'll already be in your system. Now, growing alongside that was the factory farm. Factory farm is not a very good thing in my mind, in that it treats animals horribly, it grows them in horrible conditions, and its one big thing is to put, for example, with livestock, cattle, to put as much meat on that individual as possible. And it was discovered some time back that adding antibiotics, or animals that were on antibiotics, tended to put on weight, put on muscle and fat quicker than those who weren't. So the livestock industry looked at it like, wow, even if we could double or triple how fast and how much consumable meat we can add on the hoof by adding antibiotics every day to their feed, let's do it. So this witch's brew of antibiotics and cattle feed became status quo, de rigueur. It became the normal way of doing things. Now, what happened was that anytime you use broad-spectrum antibiotics, or you abuse antibiotics, or you don't take antibiotics as you're supposed to, if you're given a 10-day course, you only take 5 and go, I feel great, I'm not taking the rest, the likelihood that a few who happen to be genetically resistant to that medication are left over. So in essence, what you're doing is you're doing a minor experiment in survival of the fittest. That those organisms, those pathogens, bacteria that were immune or resistant or could survive this medication were selectively allowed to live. So they pass on that resistance to that medication to their progeny, if you will, to be anthropomorphic for a second. And so you get increasing amounts of antibiotics that are useless against bacteria, period. Now, this kind of problem had been brewing for a long time. Both doctors and some of the ranching organizations told ranchers you need to cut out this adding antibiotics to feed. But, greed, profit, a powerful thing that often makes your integrity, morality just vanish. Poof, it's gone. So now what we found is that there are a lot of bacteria that are becoming immune to just about every antibiotic out there, including but not limited to a form of tuberculosis, which is very serious. And what many people in the research field are saying that we're we're quickly headed to what they call a post-antibiotic apocalypse. Now, it's a fancy way of talking, and it basically is saying that going at the rate we're going, the logical outcome is that as bacteria can actually interchange or share these traits, these genes, these methods of being resistant to antibiotics, you're going to find a whole wide variety of different species that suddenly are resistant to whatever the prevalent antibiotic was, whether it was ampicillin, amoxicillin, penicillin, or any of the other different classes that are not cillins, tetracycline, etc. So the doctors that are working in the field of research are finding it harder and harder to find antibiotics new antibiotics that can defeat these resistant bacteria. And in fact, some of them have said that, if things continue going like they're going, we're going to end up in a medieval times like they did back in the medieval periods, where if your arm was amputated, you might die because of infection. Simplest of procedures, pulling teeth, different kinds of operations, things that normally nowadays would be relatively innocuous and have a high survival rate, are suddenly going to find people getting horrible infections and dying of septicemia. And so there's another part in this whole litany of people to blame, and that's the MDs and DOs who have private practice, who had people coming in with viral infections, who, for example, coughing and all that, and their patient says, "Doc, I want you to give me something for this, whatever their problem was." Now, the doctor knew that viruses are not fought by antibiotics. Antibiotics are useless against viruses. But they've got this paying customer that they've known for a while, and they want to keep them as a patient, and they're demanding script. Now, the AMA, for one of the very few times they've ever done anything decent, in my estimation, came out with a memorandum telling doctors quit giving antibiotics to people who don't have bacterial infections. But again, the doctors in private practice have felt a great pressure from patients to give them something. That it's not a valid transaction in your doctor's office unless you leave with a script in your hand and can go get it filled. So the potential outcome of a post-antibiotic apocalypse is some of your worst nightmare. You could cut yourself shaving, developing RSA, your whole face swells up, there's nothing they can give you, and you die. So it means that a lot of the things that we normally take for granted, you'll cut your finger, you'll put some Neosporin or triple antibiotic on there, and you'll be good to go, are not going to be good to go anymore. In fact, now the whole finger might rot off, or your hand or whatever. So it's not it's not engaging in hyperbole nor in fear mongering to say that the notion of a post-antibiotic apocalypse is both real and terribly frightening, and that all healthcare providers need to seriously consider what they're doing when they're giving script out for antibiotics like it was candy, whether it's a Z-Pak or Augmentin or penicillin or whatever. I know that they want to do what's right for the patient, they want to please the patient, but we've got a future that's heading at us with increasing speed in which the antibiotics won't work at all. So it's either slack off now, develop new antibiotics, or another attempt, and I think this is probably going to be one of the better ones, is to develop strains of viruses which selectively go after these different bacterial infections, because they can modify the genetic code of viruses to make them more robot-like, and they can reproduce, etc., and who knows, that might become another problem. But I think biologics, as they would be called, at least in the medium term, maybe not total range term, certainly not short term, offer a much better chance than just keeping going down the quote-unquote antibiotic road, especially when a lot of the antibiotics that we've gotten in this world came from natural herbal substances, from trees, bushes, etc. And we're cutting down the rainforest at a remarkable rate. So a lot of those cut trees, bushes that are being cut down, potentially may have offered great cures for resistant infections. So that's the rant, and if you're concerned like I am, there are a lot of things on Google where you can find resources to find more out about this problem, and I appreciate you watching these videos, and as always, thank you very much. Have a great day. Bye-bye. So